Hey everybody, Dr. Oliver here of backintelligence.com, and today we're going to discuss the differences and the similarities between nerve pain and muscle pain. And we're going to show you a couple little tests that you may be able to do at home to determine which ones you have yourself. If you haven't done so yet, click the subscribe button to get access to the videos as we put them out. So a lot of times patients will come in the office or I'll talk to people and they'll not really know what they have. They'll say, I have pain here, I have pain there. Is it nerves? Is it muscles? What really is causing it? Well, there's some general guidelines to look for to see if you have nerve pain or muscle pain. And usually that's the describing words that people use for it. So muscles tend to be stiff, achy, dull, tight, those sorts of symptoms. Now you can also get sharp pain for sure if you get a spasm or if you get a strain in a muscle. You can also even get some numbness and tingling associated with it, which we'll talk about in a little bit. But the general descriptors are more on the stiff, tight, dull, achy side of things. And then when you talk about nerve pain, this is where you get all the different types of symptoms, the burning, the numbness, the tingling, pins and needles, some people say shooting type pain, pain that travels down a specific pathway. Generally, people will also describe these as kind of weird. These symptoms are abnormal that they've never had or just feel different than they've had before. So nerve symptoms tend to be more different than muscle symptoms. So something you've never experienced before just feels like very abnormal. A lot of times that cues me in to know if someone's having nerve pain or not. But again, there's a lot of similarities as well. You'll tend to see certain people with muscle pain actually start to develop numbness and tingling type symptoms. You can see this with some sort of trigger points in muscles. So a trigger point is essentially this hyper-irritable spot in a muscle that can cause symptoms to be referred to another area. This means you'll feel symptoms not necessarily where the spot of pain is, but somewhere else in the body, usually below it. This is different than radicular symptoms. So radicular symptoms are symptoms that do travel along a nerve pathway, and this is where you'll get your shooting pain, your numbness and tingling pain that travels a specific nerve pathway, whereas referred pain is a little bit broader usually, but it does go to specific areas. And if you look it up, you can look for trigger point referral patterns. They're very common patterns that we see in the human body that are shared among humans. So that is possible as well. But one way to know, is it coming from the muscles in this trigger point, or is it the nerve, is if you can find those trigger points and compress them. We have lots of videos where we show how to look for different trigger points and work on those trigger points. Well, if you can find a trigger point, let's say in your hip and glute, and you can press it, and it hurts a lot there, more than likely on a trigger point. And if it starts to give you symptoms below it or down in a different region while you're compressing that, that's more than likely a trigger point or a muscle that's causing your symptoms. And you should get relief working on it by doing soft tissue, using a ball, foam roller, different techniques that we've discussed, and just check out other videos where you can deal with these symptoms. If it doesn't get better, then maybe it's more nerve-oriented. So in this case, maybe we need to look at different tests that can tell us, is it a nerve or not? There's specific nerve tension type tests you can do for the upper extremity and lower extremity that can let us know if this is more likely. In the upper extremity, there's a few tests, 3 tests that you can try out. So if you have pain that's traveling down your arm and you want to know, is this nerve type pain or more muscular referred pain? If you take yourself through these different tests, you may be able to determine if it's nerve pain. One of them is simply just sitting out with your hand flexed towards you, and as you extend your elbow and extend your wrist, you tilt your head away and stretch. You're stretching a specific nerve pathway, a few different nerves, and if you get a reproduction of symptoms, or you literally can't even get into it without that shooting type pain or burning pain, it's more likely nerve pain within that median nerve pathway. Another one is if you take your hand, you turn your thumb down and turn underneath, and same thing, tilt your head away. Now you're stretching another group of nerves that can also reproduce symptoms down your arm. The last way is if you take your hand, you go into the OK sign, you reverse the hand over. You kind of flip it over, try to look through the hole. That's another way to stress that ulnar nerve, which is comprised of a few nerves. And if you get a reproduction of symptoms, or you just can't even get there, that's more likely that you have irritation to a nerve pathway coming out. So for the lower extremity, you can also do a test. It's a simplified test that we can do in the office, but at home you can do it as well. You just sit in a chair, sit on your bed, sit somewhere, and you're going to straighten one leg out, typically the leg you're having the symptoms in. And as you do that, you're going to put your head down, but also round your back out a little bit. If you feel reproduction of symptoms down into your leg, or you literally can't do this because of acute pain that, again, travels down your leg, this is a nerve tension test, and this is a positive sign you're having nerve pain. So differentiate between the two, because generally, nerve pain will not respond as well to stretching, and in fact can irritate it. So if you had a sciatica type symptom from that test we just did, that slumping test, you wouldn't want to go stretching it and bending down because that could be aggravating. Whereas with muscles, sometimes stretching can be helpful. Or you have that referral pain pattern we talked about. You compress the muscle, you feel the symptoms below. Well, if you compress that muscle in the right way and you get a relaxation of that sensation and you get a good dropping of the symptoms, then we know we're doing a good thing and we work on the muscles. So try these different tests, see if you can differentiate which one you have. And if it's a specific muscle or specific area you need to learn to roll out or foam roll or use a ball, check out other videos and you'll see how to do that most effectively.
I hope you enjoyed this video, and if you did, please like it and share it with a friend. Also, we'd love to send you 3 posture correction exercises that we've done with Dr. David Oliver. These videos will help correct that forward head and rounded shoulder type of posture that we're all suffering from today. So if you'd like to get those 3 videos, there's going to be a link to get them somewhere here on the video or down below in the description. Go to that page, enter your email, and we'll send you those videos right away.